Good morning. Welcome you to the Joint Government Operations Health and Welfare Committee. Education, Health, and General Welfare. I'll get it right in a minute, but it is good to see each of you on this 10 days before Christmas. I'm not sure if the House, other than Chairman Fritz, got the message that we were meeting today, so hopefully they'll show up. But if not, you'll have the Senate +1 today. But again, welcome. Let me just share a couple of things first before we start. Remind the members and the folks in the audience and at home that the action taken by the Joint Committee today can be to extend the entity by 1 to 8 years, terminate, which would put the entity in a 1-year wind down, restructure the entity, or we can make no recommendations. Our recommendations will be drafted into individual sunset bills that will be heard during full committee in the 2026 legislative session. Should be a public comment sheet to my right, to your left. If there's anyone that has any questions, if you'll sign up, you'll be recognized. And before we begin, I'll ask our members if they have any personal orders. And Senator Seal, you are recognized.
Thank you, Mr. Chairman. I'd just like to recognize one of my constituents that's out there, Dr. Michael Whiting. He's a good constituent, a true mentor of mine. So thank you for being here today.
All right. Chairman Fritz, you're recognized.
Thank you, Mr. Chairman. Just one Merry Christmas to everybody that did come in today on this cold day. Thank you for being here.
All right. We will get started with TSU. We have just a Q&A, so if we'd ask the folks. TSU, you come on up. We're going to do a roll call, and we'll ask this young lady on my right to take care of it. You're going to do it. Let's go.
Senator Crow, Senator Jackson, Senator Jackson's here, Senator Oliver, Senator Seal, Senator Seal is here, Senator Sutherland, Senator Sutherland's here, Chairman Rose.
Here.
Chairman Rose is here. We have 4 present in the Senate. Rep Crawford, Rep Glenn, Rep Haynes, Rep McKenzie, Rep Rudder, Vice Chair Fritz. Here. Vice Chair Fritz is here. You have 1 present in the House.
We got 2 present in the House now. Thank you, Chairman Rudder. Appreciate you coming in. Good morning, TSU. Thank you for being here. And if you would, make sure your mics are on. Identify yourself, and you may proceed.
Here we go. Good morning, Chairman Rose and members of the Joint Government Operations Subcommittee. My name is Dakasha Winton, Chair of the Tennessee State University Board of Trustees. President Tucker and Audit Chair Damita Smith-Knight join me today in thanking you for the opportunity to speak. We are here for your review of the TSU Board of Trustees, most of whom are sitting in the audience as part of the sunset process, an important accountability measure. We welcome the chance to show the progress this board has made in governance, fiscal oversight, and leadership since our reconstitution. The Tennessee General Assembly reconstituted the board on March 28, 2024 to address serious challenges: unresolved audits, incomplete financial statements, and operational issues. We accepted this responsibility with transparency, accountability, and decisive action. And I want to highlight a few of those actions today, and I promise I won't go over 3 minutes and 33 seconds. Since reconstitution, we've had 13 board meetings and 22 committee sessions focused on audit, finance, student success, and governance. And we've held countless informational sessions as well. We've adopted bylaws and policies on ethics, delegation, presidential evaluation, and tuition. We've selected and employed President Dwayne Tucker after a rigorous search. We've approved responsible budgets, tuition adjustments, and scholarship restructuring for sustainability. We've closed and approved programs aligned with workforce needs. We've established an audit charter, partnered with consultants, and strengthened financial management. Just as a reminder, every trustee is a TSU alumnus with professional experience. We've had 100% board presentation in the Tennessee Higher Education Commission Master Plan training, and we remain deeply engaged. We recognize that these challenges did not arise overnight, and they won't resolve overnight. We continue to address fiscal deficiencies, strengthen controls, and improve enrollment. As Tennessee's only public HBCU and land-grant institution, TSU plays a vital role in education and economic development. Sustainable change requires sustained governance. The progress we've made in just 18 months shows what focused, accountable leadership can accomplish, and we are committed to this trajectory. However, we do not celebrate this trajectory alone. We have consistent engagement with THEC, Tennessee Board of Regents, Governor Lee and his team, members of the Tennessee General Assembly, and this collaboration ensures the success of Tennessee State University as we look forward. In closing, we respectfully ask for your continued confidence and extension of the board so that we can finish the work of restoring fiscal stability and advancing TSU's mission. Thank you, and we welcome your questions.
Thank you for that presentation. Are there any questions from the board and from our committee? And Chairman Fritz, you're recognized.
Thank you, Mr. Chairman. And I so appreciate y'all's willingness to take on this role. Thank you for being here today. 2 quick questions, and I'll ask them both, and I'll be quiet. What has been the greatest challenge met by the board to this point? And if you would speak a little bit about that, perhaps. And then how would you rate the trajectory, I'll use your word, I like that, of student success in the last 18 months? And where do you see that going? Thank you.
Sure. I think the greatest challenge has been, and I will speak for me, and I know our chairwoman of our audit committee will have some opinion about that too. But I think the greatest challenge is us trying to figure out where we build and start the process in terms of our transformation. We had to figure out, when something's so difficult that you have to go through and evaluate, where do you even begin? And how do you try to get to a good place when you have so many difficult issues to address? I mean, the audits obviously are concerned, the finances are concerned, and trying to establish that, and President Tucker uses this all the time, trying to make sure that we establish a culture of that accountability. That I think those things were probably the most difficult that's for me, and I'll let anyone else chime in on the first one.
No, I absolutely agree. I think it was a lot of work that needed to be done and trying to figure out exactly where do we start, and knowing that time wasn't necessarily on our side. So the audits have to be completed at a certain time. Accreditation work needed to be done at a certain time. So how do we address all of those things immediately? And I think we appreciate the work from THEC, TBR, being on site, helping us as a board understand, what the biggest opportunities for improvements are and helping us create those plans to address them.
Just one follow-up. Thank you, Mr. Chairman. And the rate of, how would you rate the trajectory of the student success at this point in time? And I'll follow with one thing you interested me with this. I learned when I joined the Army back in '83 how to land navigate. And how to get to where you want to go, you have to know where you are. And sometimes there's a lot of energy goes into the terrain association of determining just where you are and where you've been to get to where you go. So just know that there will be lots of people praying for you, that you do a good assessment and get a trajectory and an azimuth set toward success for Tennessee State. And I would be interested to hear about your student success.
So in the last 18 months, we continue to graduate a multitude of students. And while our enrollment this past year was probably the lowest that we've seen, we've already taken actions to ensure that enrollment continues to go up, and that we offer a quality education to the students so that they can go out and be prepared for the workforce.
All right, thank you. Any other further questions from our committee? Any from the public? Seeing none, do we have a motion? Chairman Jackson, you're recognized.
Thank you, Mr. Chairman, and I would like to make a recommendation to extend the Tennessee TSU Board of Trustees for 3 years.
All right, thank you. We have a motion, we have a second. Got a second, Senator Seal. All right, no objection to the vote. We'll take a roll call vote in the Senate. Madam Clerk, please take the vote in the Senate.
Senator Crow, Senator Jackson. Senator Jackson votes aye. Senator Oliver. Senator Oliver votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Rose.
Aye.
Chairman Rose votes aye. We have 5 ayes.
And we'll take a vote.
No vote in the House because we don't have a quorum. So passes through.
All right, passes through with the positive vote from Senate, 3-year extension. Let me just say to you, I appreciate Chairman Fritz's comments. Thank you so much for your efforts for taking on a Herculean task. And we just look forward to hearing great things from TSU. Thank you again for all that you do to educate the students of Tennessee and beyond. God bless and Merry Christmas. All right, thank you. All right. Thank you so much. All right. Next on our agenda is the Board of Optometry. If you will come forward. And I think you know the drill already, but make sure your mic's on. Identify yourself. Okay. And we'll ask the auditors to give your report, and then we'll ask the agency to respond. So auditors, if you will, recognize, tell us who you are, and you may proceed.
Good morning, Chair and members of the committee. My name is Taylor Fritz, and I'm a legislative senior auditor with the Comptroller's Office Division of State Audit.
I'm Dr. Linda Tharp, past chair of the Board of Optometry.
I'm Kimberly Wallace, Administrative Director for the Board of Optometry.
All right, thank you again for being here. You may proceed with your presentation.
The Board of Optometry's mission is to safeguard the health, safety, and welfare of Tennesseans by requiring that all who practice within this state are qualified. To do this, the board determines the standards for the optometric profession and licenses optometrists. The board is also responsible for investigating allegations of misconduct against optometrists and disciplining those who are found guilty. State statute administratively attaches the board to the Department of Health's Division of Health-Related Boards. Health-related board staff provide administrative support to the board by reviewing licensure applications, providing customer service, and preparing for board meetings. The board also receives support from the Department of Health's Office of Investigations, who investigate complaints. We audited the board for the period of July 1st, 2021 through August 31st, 2025. We reviewed the board's process to comply with composition, attendance, and quorum requirements, to comply with the Open Meetings Act, and to disclose conflicts of interest. We reviewed the board and health-related board management's process for issuing licenses, ensuring optometrists completed continuing education, investigating complaints and issuing disciplinary actions, and ensuring the board remained self-sufficient. For the areas we reviewed, our work resulted in 1 finding and 1 observation. We will only be discussing the finding in our presentation. The finding can be found on page 19 of the report. In Tennessee, optometrists are required to complete 40 hours of continuing education every 2 years. When optometrists don't meet these requirements, the board can issue disciplinary actions and assess monetary penalties. To help track and review continuing education, the board contracts with the Association of Regulatory Boards of Optometry, or ARBO. Unlike most boards, as part of their contract, each month an ARBO staff member reviews continuing education documentation for all optometrists whose licenses are close to expiration. The ARBO staff member identifies those who failed to meet the requirements and sends the listing to the board director. Instead of using this listing to follow up with the deficient optometrists, health-related board staff take a random sample of 5% of the entire list. This means that the sample selection includes both optometrists who were identified as compliant and those who were identified as deficient. Under this process, there is no guarantee that health-related board staff will select any of the deficient optometrists for further review or discipline. For the first 8 months of this year, 439 optometrists had licenses that were expiring. During their monthly review, ARBO staff identified 78 of these optometrists who did not comply with the requirements, which was 18% of the total. Although the deficiencies were identified, the department's 5% random sample only selected 3 of the 78 deficiencies. These 3 optometrists had disciplinary actions initiated against them, including monetary penalties. Because the board strictly adheres to the 5% sample methodology, they did not follow up on the remaining 75 individuals that they knew were not compliant. This demonstrates that the 5% sample method allows known noncompliance to persist. The board pays ARBO $35,000 a year for their services, which includes a full review of the continuing education of all optometrists. Health-related board staff could save time and effort by performing follow-up on the ARBO-identified deficiencies and forego the 5% random sample, which is not designed to mitigate the risk of non-compliant optometrists and the associated public health risk. Following up on all known deficiencies promotes fairness by applying a consistent standard to all optometrists and ensures they are fully held accountable for not meeting the profession's continuing education requirements. Management concurred with this finding, and that concludes our comments on finding 1.
All right, thank you. And I believe you said that's the only thing you're going to report on is just that one
Yes.
finding. All right, from our committee, are there any questions to the auditors about the findings? Chairman Fritz.
Thank you, Mr. Chairman. Mr. Chairman, my question is both to the auditors and to the board, if it's appropriate to ask at this point in time.
I would say, why don't we let the board respond, and then we'll let you answer both, okay?
Thanks, sir.
So any other questions to our auditors? Seeing none, we'll go to the board. Would you please recognize yourself and tell us who you're with?
Good morning, Chairman and members of the committee. My name is Grayson Carter. I'm the Assistant Commissioner for the Office of Legislative Affairs for the Department of Health. With me today, I have Jennifer Putnam, who is the Assistant Commissioner of Health Licensure and Regulation.
All right, you may proceed.
Thank you, Chairman. I have a little background on that one finding. On July 1, 2022, the board entered into a contract with the Association of Regulatory Boards of Optometry, or ARBO for short, as a vendor to audit licensees. In the board's meeting held on April 6, 2022, the board voted to go from a 100% audit to a 5% audit monthly for continuing education, which is in alignment with the percentage that is audited by most other professions licensed by the health-related boards. ARBO has continued to audit all licenses despite the board notifying ARBO of the board's April 6 decision to only audit 5%. The ARBO audit showed 78 deficient licenses, deficient meaning that licensees had not submitted documentation to ARBO to confirm their compliance with the CE cycle requirements. The board disciplined 5% of the license, 78 identified, which would be 3 licensees, to be consistent with its policy, but understands the remaining 75 could have been reviewed for discipline. Effective October 8th, the audit procedures have been amended to review 100% of licenses found to be deficient by the vendor and to pursue discipline when applicable.
All right, thank you. I believe Chairman Fritz, you had a question, so proceed.
Thank you, Mr. Chairman. And I'll preface the question with the audit conclusion, last sentence, and it just simply says, pardon me, which may pose a health and safety risk to the public, and it listed on page 19. And then I'll ask y'all to take your attention to page 44 and 45 of the report. And here's the twofold question that I would like to ask. Do the auditors draw any correlation, and does the board draw any correlation to the finding and the fact that from 2022 to 2025, the percentage and the dollar figure of training funds applied to the board has gone down? So is there a correlation to the reduced spending in both proportion and in dollars? And does that have some correlation to this potential risk?
All right, I think that's supposed to both. Is that correct?
It is, yes.
All right, why don't we have our auditors, let's let the board respond first. Let's do that. Board, Ms. Putnam, you were recognized.
Thank you, Chairman. I appreciate it. And thank you for the question. I want to make sure that I'm understanding the question correctly. Is the question that in the reduction of the 5%, is that also have a monetary reduction in the funds by the board?
No, ma'am, I apologize. Let me
thank
be
you.
more clear. On page 44 and 45 of the report, it shows in 2022, training for the board was at $36,000, accounting for 16% of the total budget. And that goes up and down a little bit. In 2025, that number is $35,000, accounting for 13% of the budget. So my question is, do those figures and the reduction in training dollars correlate to the fact that we have this finding?
Thank you for the clarification. The answer to your question is no, they do not correlate, and I'm happy to expand on that. So the training budget that you're seeing in that report is for when our individuals go to conferences and leadership training, examples such as that. This particular instance is when we receive the report from ARBO that indicates who may be deficient. That is then reviewed. We receive the the licensees must submit documentation to the board showing that within the time frame in which I was audited, here are my certificates of completion showing that I did obtain the hours required by the rules set by this board. Now, either the individual did not get all 40 of their hours, let's use an example, they sent in 38, or they did not provide the documentation that was needed to show that they were compliant at all. Conversely, this was also during COVID, which during this time, the continuing education policy instituted by the commissioner at that time allowed for flexibility on not having to complete in-person hours as a result of COVID. So several individuals could have been in that category as well, where they didn't complete the information based on that existing policy. As a result, though, however, the board does acknowledge that of 75 people of the total 1,380 licensees, there were 75 that were identified as deficient, and policy at that time was to only discipline 5%, which does result in the 3 that was identified by the audit. So that is in fact correct. And we certainly hear the recommendation of the audit team and accept those. And moving forward, while we were still in contract with this vendor beginning in October, everyone that is identified as deficient is put through the disciplinary process. And just to expand on what that is, so you have a better understanding, when an individual is identified and deemed to be deficient with their continuing education hours, they are provided what's called an agreed citation. That citation gives them the opportunity to agree to make up the hours in which they are deficient, and they are also assessed a monetary civil penalty per hour in which they are deficient. They then sign that agreement and send it back to the board. Should they not pay that monetary penalty and not complete the hours in which they were deficient, whether that was 1 hour or 5 hours, then it can go to the Office of Investigation for a formal investigation and the possibility of formal discipline being instituted on their license, which would be reviewed and determined by the board.
All right, thank you. Chairman Fritz. There would-
Yes,
You'd like to
Taylor
respond,
Fritz.
go ahead.
From the comptroller's office, and I would agree with that. As the way that things are accounted for, this is information from Edison, and in that training of state employees, the training line, it does include that $35,000 contract. So there's really just a small portion of that that is related to the training expenses. Most of that each year is their contract fee.
Thank you, Mr. Chairman. Just one follow-up. I just thought it was, I understand the different pot of money and what this is being used for, but I just wonder if there is a correlation in the leadership part of it, because setting the example of how important training is, did that flow down into the board and to the members, to the optometrist, that they perhaps saw a lesser importance placed on satisfying the training requirement?
Thank you for that question. So I think it's also too in how that category in the budget is listed. So as the auditors did confirm, that $35,000 is simply to have the contract with ARBO for ARBO to pull that information and to send that report to us. There's not a training component in terms of staff being trained on pulling those audits, as that is done by ARBO, and what that $35,000 is done for. That's where it falls in our budget line, the training category, but that is not specifically training that the staff does. In order to do the random audit, what our staff did is, because most of our health-related boards, actually all of them absent one, have a 5% audit rate. So they took the numbers that were identified by ARBO and only disciplined 5% of that. So there wouldn't be a training component, since ARBO is pulling that information and providing it to the staff, but I certainly understand how it gives that perception because of the budget line item of where it falls in the training category, but there's actually not a training component to staff for the report that's provided there. The names are identified as who needs to receive the notification indicating that they've been identified as deficient and afford that licensee the opportunity to show that they were in fact compliant and provide those proof of certificates, or for them to acknowledge that they did not complete those hours and then be given the opportunity to enter into the agreed citation to have an opportunity to make up those deficient hours.
Just one follow-up. I may
Yes,
be
sir.
confused just a little bit. I apologize. So I understood the first answer that this training figure was all about travel to and for training. And then what I understood in the second answer was this was to the contract for the folks doing the evaluation. So which is it?
So it's both. So that training line budget encompasses all of our expenses that would be deemed as training. So the first example that I gave, and again, I apologize, happy to clarify, is should one of our board directors or our board regulatory support staff go to a conference such as the Federation of State Medical Boards, any conference in where they can receive additional training and participate and commune with other individuals who do board work throughout the state, that comes out of that training budget. The contract for ARBO also comes out of that training budget, but it's not a training component. So again, we can certainly flesh out with F&A as to why that's the category they put that in, but you're absolutely correct, sir. There's not a training component to that. And so that's why it gives the appearance that there could be a correlation of a reduction. Yes, sir.
Thank you. Thank you, Chairman Fritz, and thank you for those responses. Any further questions from our committee? Any public comments? All right, seeing none, we'll entertain a motion. Chairman Jackson, you're recognized.
Thank you, Mr. Chairman. And what I would like to do is to recommendation of extending the Board of Interstate, for the Board of Optometry for 5 years.
All right, you have heard the motion. Do we have a second? Senator Seals has seconded the motion. Any objection to the question? Seeing none, we'll take a roll call vote in the Senate. Madam Clerk, please take the roll call vote in the Senate.
Senator Crowe, Senator Jackson votes aye. Senator Oliver votes aye. Senator Seal votes aye. Senator Sutherland votes aye. Chairman Rose.
Aye.
Chairman Rose votes aye. Chairman, you have 5 ayes.
All right, we still don't have a quorum in the House, so to move forward to the full committee with a recommendation for a 5-year extension. Thank you so much for being here today. We appreciate you very much. All right, next on our agenda is the Interstate Medical Licensure Compact. It looks like Ms. Putnam and Mr. Carter are staying put, and we'll ask the auditors with the Interstate Medical Licensure Compact to come forward, or auditor. Q&A, excuse me. This is just Q&A. My apologies. So, okay. All right, my apologies. This is just a Q&A. Ms. Putnam, you're recognized, or Mr. Carter, and if you will recognize other folks that have just joined us, please.
Good morning again, Chairman and members of the committee. My name is Grayson Carter. I'm the Assistant Commissioner for Legislative Affairs for the Department of Health. With me today, I have Jennifer Putnam, Assistant Commissioner of Health Licensure and Regulation, Dr. Stephen Lloyd, who is the Board of Medical Examiners Board Chair, and Dr. Michael Whiting, who is the Board Chair for the Board of Osteopathic Examiners. Ms. Putnam will now provide a presentation on the Interstate Medical Licensure Compact.
All right, thank you, Ms. Putnam. You are recognized.
Thank you, Chairman. Good morning, committee members. The Interstate Medical Licensure Compact is an agreement among participating states that expedites the licensure process for medical practitioners and osteopathic practitioners who are licensed in one state but desire to practice in multiple states. The licensure compact is made up of representatives from each of the compact states, with those respective states issuing those medical licenses. Now, the compact currently has 40 states, including the District of Columbia and the Territory of Guam, with other states looking to introduce legislation this upcoming session to also adopt the compact. There is no cost to the state to participate in the compact. However, there was a one-time fee of $82,577, which allowed the state to create a data extract that would allow the state to both receive and send data from its state licensure database known as LARS to the Compact's licensure database. That concludes our presentation, and we're happy to answer any questions you may have.
All right, thank you. Do we have any questions from our committee? Chairman Jackson, you're recognized.
Thank you, Mr. Chairman. And just my question is, on this compact, the ones that are qualified in another state meet the requirements there, and the state of Tennessee may have different qualifications. Are they required to meet these qualifications, have the same training in Tennessee that they would that they might not have gotten in another state?
Thank you. Yes, sir, they are. They are ensured that they are, not only they are licensed in their original home state, but that they have to go through additional criminal background checks, vetting through the compact, which is only done through those members, to ensure that they are competent clinically and professionally to come into Tennessee and practice. We then also vet to make sure they meet our requirements as well before Tennessee issues them the capability to be able to come in and treat our citizens.
Go ahead.
I would just like to say thank you for Dr. Stephen Lloyd for being here. Dr. Lloyd is a very valuable resource and testifies at a lot of committees with his knowledge of a lot of different things involving healthcare. And I appreciate you being here today. So it's always good to see you. And I'll tell my family you said hello.
My pleasure, Senator Jackson. Thank you. And please do.
All right, thank you so much, committee. Any further questions from our committee? Any public comments or questions? All right, seeing none, we will entertain a motion, and Chairman Jackson, you are recognized once again.
Thank you, Mr. Chairman. And what I'd like to do is recommend to extend the Interstate Medical Licensure Compact for 8 years.
All right, you've heard a motion to have a second. Senator Seal has made a second. We do not have a quorum in the House, so we'll take a roll call vote in the Senate. If there's no objection, seeing none, please take the roll call vote.
Senator Crowe, Senator Jackson. Senator Jackson votes aye. Senator Oliver. Senator Oliver votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Rose.
Aye.
Chairman Rose votes aye. You have 5 ayes.
All right, the Interstate Medical Licensure Compact moves forward to the full committee with a recommendation for an 8-year extension. Thank you all for being here. Appreciate your input. All right, thank you so much. Next, we'll move to the Tennessee Child Facility Prevention Team, and this also is Q&A. Mr. Carter, it looks like you are staying in your seat. Once they get seated, if you will, introduce the rest of your team, and y'all may proceed with your presentation. Thank you.
Thank you, Chairman and members of the committee. If you don't know by now, my name is Grayson Carter, and I am Assistant Commissioner of Legislative Affairs for the department, and I'll let the rest of our staff introduce themselves.
Good morning, Chairman and Chair members. I am Ashley Moore, Section Chief for Injury Prevention and Detection within the Division of Family Health and Wellness at Tennessee Department of Health.
Good morning. My name is Nicole Anderson. I'm the Child Fatality Review Program Director at the Tennessee Department of Health.
Good morning. I'm Dr. Angela Miller. I'm the Deputy Director for Child Health and Injury Prevention at the Tennessee Department of Health.
All right, thank you for introducing yourself, and you may proceed with your presentation.
The Tennessee Child Fatality Prevention Team and Review Program was established by the Child Fatality and Prevention Act of 1995. The goals of the CFR are to review all deaths ages 0 to 17 born at least 23 weeks gestation or 500 grams of birth weight of Tennessee resident children to improve the state's response to child fatalities, provide accurate information on how and why Tennessee children are dying, and to prevent future child fatalities in Tennessee. The Child Fatality Prevention Team, also referred to as the CFR State Team, is attached to the Department of Health for administrative purposes and is composed of a variety of leaders from across our sister agencies. And some of their primary responsibilities include reviewing reports of child death, in developing a report that is issued to the governor and the General Assembly concerning the state of the team's activities, including recommendations for change to any law, rule, or policy that would promote the safety and well-being of children. Additionally, we develop protocol for the collection of data regarding child deaths and also provide technical assistance to the 34 local teams that are located across the state to support the review of child deaths. In addition to that, we periodically assess the operations of the program and the recommendations that we made to understand any changes that may be needed.
All right, that concludes your report. I'll ask our committee if they have any questions. Chairman Fritz, you are recognized.
Thank you, Mr. Chairman. Thank you all for your time today. Just a quick question. The Child Fatality and Prevention Act of 1995, did that specifically, and I apologize, I did not review this, did that outline the 0 to 17 born at least 23 weeks of gestation or 500 grams, or is that a rule?
So it does outline the ages that are required to be reviewed. There is separate TCA that identifies the standard for viability, which would be that 500 grams weight or 23 gestation age.
Okay, thank you so much.
All right. Thank you, Chairman Fritz. Any further questions from our committee? Any public comments or questions? Say, Chairman Jackson, a question, or are you ready to make a motion?
Question.
Go right ahead, sir.
Thank you, Mr. Chairman. And child fatality, I'm on what's called the Second Look Commission through the Department of Children and Youth and Department of Children's Services. And we get reports of children's death. Do you also investigate those of maybe drug related or just physical abuse or whatever? Is that you do those as well?
We only review the deaths, so there could be some overlap potentially in the cases that are reviewed by the board that you're speaking of. But we're only looking at deaths, and there could be abuse or drug exposure identified in that review process.
Do you keep that data as far as separated out as to the cause of the death, and is it reported to other agencies? Like for example, to the Department of Department of Children and Youth or whatever?
So our meetings are closed and confidential. We do have representation from DCS within the local review teams. So they bring their records to share that information at those meetings, but we wouldn't be reporting out any of that information to any other entity.
Thank you.
All right, I think next we have Chairman Fritz. You had another question, and we'll go to Senator Oliver.
Thank you, Mr. Chairman. Just one follow-up. Does the department consider, I understand the code, but does the department consider a child that passes less than 23 weeks a death and just review those past 23 weeks? Is that what I understand?
That is a great question. In terms of CFR, you are correct. We only review cases that fall within that standard of viability. However, we have a separate program that is called the Fetal and Infant Mortality Review Program. That program is only established in our metro, so that would be Memphis, Nashville, Knoxville, and Chattanooga. And they get to decide what their cohort would include. Some of them do review cases of death that would fall under that threshold.
Thank you so much.
All right. Thank you. And Senator Oliver, you are recognized.
Yes, thank you. Thank you for being here. I certainly understand the importance of having a child fatality review committee. It's important to understand that. But what I'm trying to really glean is what should we be doing? What action should be taking from this commission? What should the legislature be analyzing from this data? Like, why is it useful? I guess that's what I'm trying to understand. What are the categories of fatalities that you're looking at? Is it all this? Is it health related? Is it gun related? Like, help me understand what exactly you're looking for and what actions are taken as a result of this data.
Sure. So just to start, to give you all some context, We start with the death file. Anytime a death occurs, we receive a death certificate and birth certificate from the Office of Vital Stats. And then we relay that information to our 34 local teams, who then go through the process of collecting records to really try to paint the full picture of all the circumstances that are involved in the case. It could be, as you mentioned, Representative Fitz. It could be, I'm sorry, I'm misnaming, I should have spoken. Chairman Jackson, you mentioned child abuse or drug exposure. So we're looking at education records, we're looking at DCS records, medical records, interaction with law enforcement, EMS, firefighting, wherever we can get information. They're taking that information, discussing it during the meeting to really paint a picture of what circumstances could have caused the death. And so from there, they generate recommendations, prevention recommendations to funnel up to our state team. And we share those recommendations with the state team, along with all the aggregate data that we're able to compile from the deaths that have occurred over any given year to release an annual report, which we submit to you all on an annual basis, which includes the aggregate data, along with prevention recommendations that we would suggest for either just statewide implementation. And most of those focus on activities that we as a department can lead. But certainly it's there for your perusal in consideration of policy and legislation that you can pass to impact the health and welfare of children. We cover all deaths, so that's medical causes and external causes.
Do you have follow-up?
No.
Senator Hopper, okay, thank you so much. Chairman Jackson, you're recognized.
Thank you again, Mr. Chairman. And my question deals with autopsies of children that need an autopsy. Not all of them maybe do, but the length of time that it takes to get an autopsy report back, I know sometimes can be lengthy. Just to elaborate on that a little bit, is if you would, if that's what you face sometimes when an autopsy is required.
Yes, certainly we do rely on the information in the autopsy report. I would say that our review turnaround, Nicole may be able to speak to this more, but it's about a year. So in terms of completing a full cohort, so the full calendar year of child deaths. So it takes us about a year to do that. In some, of course, autopsies come in quicker than others, but we try in most cases to include all of the deaths that occur within that calendar year in our annual report.
All right, thank you. Are there any further questions? No, I have one I'd like to ask, and I'm kind of following up on Senator Oliver's question, and you may have answered it, and I didn't grab it, so I'm gonna try again. So you were entitled the Tennessee Child Fatality Prevention Team. From what I'm hearing, you're gathering data on what happened, how many children, but how does that equate to prevention? Can you share a little bit about that? How do we disseminate that information to our citizens so that we are preventing those fatalities? If you would respond to that, please.
That's a wonderful question. Our primary method of sharing our information with the public is through our annual report. We really rely on the partnerships that we've developed across the state to convey that information within their local setting. So we provide the prevention recommendations, and those include very detailed descriptions of what they can do within their local context to help address child fatalities. And so the thought is that by releasing this report on an annual basis, which is informed by the data that we're collecting from across the state, that they'll be able to make some meaningful impact within their local context to help address the issue of child fatality in their area.
Okay, thank you. I appreciate that. Any further questions from our committee? Any public comments or questions? All right, seeing none, we will entertain a motion. Chairman Jackson, you are recognized.
Thank you, Mr. Chairman, and I make a recommendation to extend the Tennessee Child Fatality Prevention Team for 5 years.
All right, we have a motion. We have a second. Senator Seals has seconded that. Okay, no objection to the question. We will take a roll call vote in the Senate. Madam Clerk, please take the roll call vote in the Senate.
Cinder Crowe, Cinder Jackson.
Aye.
Cinder Jackson votes aye. Cinder Oliver. Cinder Oliver votes aye. Cinder Seal. Cinder Seal votes aye. Cinder Sutherland. Cinder Sutherland votes aye. Chairman Rose.
Aye.
Chairman Rose votes aye. Chairman, you have 5 ayes.
All right, thank you. The recommendation for 5-year extension moves forward to the full committee. Thank you for being here. Appreciate you so much.
Thank you.
Mr. Carter, are you through?
I think so.
Merry Christmas to you. All right. Our last item is the Tennessee State Veterans Home Board, and this is an audit, so we'll need the agency and the auditors to come forward. We'll recognize the auditors first and ask you to identify yourself, and then for the record, just who you're with, and then we'll move over to the agency. But again, thank you all for being here.
Good morning, Chair and members of the committee. My name is Robert Harness, and with me today is my colleague Angie Glore. We're legislative auditors in the Comptroller's Office Division of State Audit, and we're here to present the results of the 2025 performance audit of the Tennessee State Veterans Homes Board.
All right, thank you for being here. If you would, you may proceed with your audit findings, audit report.
Thank you. The agency's mission is shown on the screen. It emphasizes the upholding the residents' rights and promoting a high quality of life. Our audit scope was from July 1st, 2022 through June 30th, 2025. With the department's mission in mind, we focused our review on the board of directors, the board's financial position, the home's federal star ratings, recruiting and retaining staff, resident clinical assessments, resident care and physician billing, complaints, resident wait lists, and nursing coverage. For the prior audit, we reported 4 findings and 9 observations. Of those 4 prior findings we followed up on, 1 finding was repeated, 2 findings were resolved, and 1 prior finding was partially resolved. During the current audit, we reported a total of 6 findings, which include 1 repeat finding and 5 new findings. We also reported 6 observations. Finding 1 begins on page 16 of your report. Management has not developed a specific plan or strategy to address the veterans' home's financial position. In addition to our performance audit, our office performs a financial audit of the board's financial statements each year. By examining the historical financial statements and interviewing management, we became aware of a downturn in the financial health of the homes over the last several years. As you can see on the screen, the home's operating revenues decreased in fiscal years 2021 and 2022. Management stated this was because during COVID-19, many families chose not to place their family members in nursing homes. Despite revenues recovering in recent years, the homes have continued to suffer operating losses since 2020, as shown on the screen. Management stated that there were various reasons for the losses, including the pandemic, the opening of new veterans homes in Cleveland and Arlington, as well as ongoing repair costs at established veterans homes. The home's cash balance has declined from $25.6 million at the end of fiscal year 2021 to $16.5 million at the end of fiscal year 2024. And during the board's most recent financial statement audit, our auditors found an error in the statements that resulted in an overstatement of $7 million in the cash balance, which required adjustments to those statements. In addition to the adjusting entries, management stated the decline in cash balance is related to various expenses of building and opening the 2 new homes, also as well as one-time technology upgrades at the homes and ongoing repair issues to the home's HVAC units. Although the home's net position has increased in the financial statements, this is largely due to the construction of the new homes. While capital assets have increased, only 14% of their net position is unrestricted funds available to cover operating costs. When we examined management's strategic plan, we noted that it did not include specific steps of action to turn the operating losses around. It's important that management identify and address the operating losses or the board risks ongoing financial instability, which could threaten the continuity of operations and the quality of care provided to their residents. Management concurred with the finding. I'm going to turn it over to my colleague Angie Glore at this point.
My name is Angie Glore, Legislative Senior Auditor with the Comptroller's Office. Finding 2 can be found on page 21 of the report. Per policy, residents must opt in to the Resident Trust Fund program. We found that the Murfreesboro and Clarksville Veterans Home did not obtain written authorization from the residents to manage their funds. The Clarksville Veterans Home staff did not maintain a copy of the withdrawal receipts or obtain the resident's signature on the receipts that were maintained. We also noted that the executive office did not accurately perform monthly reconciliations of the resident trust accounts. When management fails to follow policies for accurately accounting for resident funds, there is an increased risk of mismanagement of the residents' funds. Management concurred with finding 2. Finding 3 can be found on page 35 of the report. This finding discusses the Veterans Home nursing staff turnover. Nurses are the core employees of the Veterans Home Board. The board has experienced significant turnover of nursing staff during the audit scope. Management has faced challenges in hiring and retaining staff, which include a shrinking nursing market and competitive pay. To address these challenges, the board and executive management provided nursing staff with above-average salaries, bonus payments to nurses who retain employment, and develop employee feedback programs. We noted that the above-average salaries and bonus programs have not been fully effective in retaining staff. We also noted that management did not consistently use feedback programs to gather information on why so many employees voluntarily left. As core employees, the nursing staff provide vital care to resident veterans. Without the nurses, the board and management cannot efficiently operate the veterans' home and ensure the residents receive the consistent quality care they need. We recommend that the board and management develop an aggressive plan to address the staff turnover and evaluate the methods management has designed to gather feedback from current and former employees. Management concurred in part with finding 3. Finding 4 can be found on page 38 of the report. The finding discusses management's improper claim for reimbursement from the Federal Nursing Retention Grant. The Department of Veterans Affairs approved the board's application for the nurse retention grant aimed at curbing the ongoing nursing shortage by providing bonuses to nurses who retain employment. Based on our review of the grant agreement, we found that the Department of Veterans Affairs had not approved the new hire retention bonus payments as allowable program for federal reimbursement. During our discussion with management and review of the quarterly reimbursement invoices submitted to the Department of Veterans Affairs, executive management improperly invoiced $94,062 in new hire retention bonus payments for the federal financial year 2025. Management did not concur with finding 4. Finding 5 can be found on page 44 of the report. The staff complete clinical assessments throughout the resident stay to build rapport and ensure their physical needs are met. We noted in the prior 2 audits and again in the current audit that management did not perform or document timely supplemental clinical assessments as required by internal policy. Based on our test work, we found that 60 sampled residents, 37 residents had 1 or more missing assessments, and 1 resident did not receive an assessment during our audit scope. Management concurred with finding 5. I'll turn it over to my colleague, Robert Harness.
Robert Harness with State Audit. Finding 6 is on page 50. The homes contract with mental health care providers to visit residents who have consented to receive these services. The providers bill the homes for each visit. Because providers schedule how often they visit each resident based on that resident's needs, it's important that nursing home management have processes in place to verify that mental health providers actually performed the visits they are paying them for. The homes have a policy that requires each provider to sign in and out of the home using the AccuShield software system and to complete what's called a provider billing log with the name of each resident they visited. They are required to turn the log in at the end of each day they visit, and staff are required to compare the names on the log to medical notes the provider later sends. Fiscal staff also check the records to make sure the provider logged in at the home and that the residents being billed for were present in the resident census on the invoice dates. However, based on our test work, we found that staff were not consistently performing these checks before reimbursing the providers. We found multiple instances where providers did not sign in and out of the homes or submit medical records. We found that the policy did not include specific actions or name the positions responsible for carrying them out, which led to confusion among staff about what was required. If staff do not verify the services were actually provided, it opens the door to potential fraudulent billing, and perhaps more importantly, residents may not receive the services they need. Management concurred with the finding. This concludes our presentation of the 2025 State Veterans Homes Board Sunset Audit. We'd like to thank the chair and members of the committee for your attention, and we're available for any questions.
All right, thank you for being here. We will, at this moment, we'll ask you any questions for the auditors. Now, Chairman Fritz, do you have a question for the auditors? You'll wait. Any questions for the auditors? If not, we'll go to the agency, if you will. You folks are willing to, are ready to respond. Tell us who you are and remind the audience who you're with, and you may proceed.
It's on? Okay, thank you. Going to finding one.
Before you
sorry.
do that, remind us who you are, who
I'm
you're
sorry,
with,
yeah.
and introduce the entire board there, if you would.
Of course. I'm Ed Harries. I'm the Executive Director of the Tennessee State Veterans Home Board. With me is Sandra Cottle, who is our Director of Clinical Compliance, and Adam Fleming, who is our Director of Finances. Moving on to finding one for the plan. Two things we have done to correct this finding. As we concurred with it, we have met last week with customer-focused government that was on 12/11. We are setting a long-range plan with them, a series of meetings so that they can help us make our strategic plan more robust and address the issues that the auditors brought forward. Our board is heavily involved in the strategic planning process. And we will be having strategic planning board meetings, specific meetings, starting in January. Currently, our census in the buildings has risen greatly. Although we did not have a cohesive plan, we have operational plans, marketing plans. We actually, under the guidance or request of the State Funding Board, we redid our budget and created a pro forma that would show how we would come out of the financial issues we were dealing with. Biggest financial issues had to do with funding the Cleveland building, which took a significant amount of time to get compliance and certifications. So therefore, we had patients on board that we had to pay for, and we got no reimbursement for that. That came upwards of $2 million in cost by the time we got all that done. There were some other issues that were developed at the Cleveland building with the facility, but with that was one of the major reasons why we had a major deficit. Going back to COVID, our census dropped dramatically, as it did in all nursing homes. The public lost faith in the nursing home industry, and we were included into that mix, although we performed better than the average nursing homes with that. So the biggest takeaway here is that this finding will not be repeated in the next audit.
Okay, thank you. Does that complete your report?
That's for finding one. Do you want me to go
I got
through?
you. Yeah, I think we'll pause right there and see if any questions on finding one from our committee. Seeing none, we'll for finding one. Okay, we'll go on to finding two then, if you would,
Finding
please.
two?
Thank you.
All right, finding two, staff at two veterans homes did not obtain written authorization to manage personal funds and did not follow resident trust withdrawal procedures and did not accurately perform monthly reconciliations. We concur with that. What we have done is in January of 2025, we retrained the staff and initiated a reconciliation that's happening on a monthly basis. There have been no failures since January of 2025, and we do not see that this finding will be repeated in the future.
All right, thank you. Any questions on finding two? Not, move on to finding three, please. Thank you.
Finding three, the board and management have not effectively addressed the nursing home staff turnover to ensure residents receive consistent quality of care and the homes operate efficiently. Again, we concur in part here. We have done quite a bit trying everything from using reimbursement grants from the VA that would help with retention and with recruiting. And we actually have a referral bonus for employees if they bring on an employee and then they stay after a certain time period. We seek our wage scale. We strive to be about 85% of where the wages are from a report put out by the Tennessee Healthcare Association, which shows all nursing homes and what those wages are. Our turnover, although it is high, it is significantly an issue in our Murfreesboro and Middle Tennessee market, and a lot of that is based on actual available labor pool and the very competitive market that we have with other nursing homes as well as with other industries coming in on board. That market has not settled down from the frontline worker end of things. Staff satisfaction surveys, we initially commissioned a product called Pinnacle that did surveys for us. However, TennCare initiated as part of their Quilts program, a survey that they send out to the residents and families and staff. And so we use that as our basis for the survey. That goes to every nursing home gets the Quilt survey. So we did not move that. Now, looking back at it and with the guidance from the auditors, perhaps that survey is not robust enough. And we are looking at that as to what questions are in there and what do we need to add to do that. Additionally, we implemented what's called Voice of the Employee, which is a texting program for all of our employees. It works through our payroll system for real-time communication with employees, and they can also communicate directly with us. We also had an issue with evaluations not being done promptly, and we have corrected that as of July 2025. As of now, evaluation process is working fine, and again, I do not foresee a repeat audit in that area.
All right, that was finding three. Any questions on finding three? Not, proceed to finding four, please.
Okay, finding four, management improperly claimed reimbursement from the federal nurse retention grant. Definitely not by intent, and that's not why we do not concur. The intent of the grant under 38 CFR Part 53.11b, the purpose of the grant is for employee incentive programs to reduce the shortage of nurses at the state veterans homes. This is a federal program, goes to all state veterans homes across the country. What we did was our grant was not specific enough and broken down enough to allow for the recruitment grant. As such, as a correction process, we have contacted the VA. They have not yet gotten back to us on that to see if we've done anything improper, and if so, what do we need to repay, if anything at all. Last week, we did have an auditor come from the VA, federal VA, who looked at the retention grant payouts at just the Knoxville building, and she left with no issues and stated that our process is better than the other states she's looked at so far. So we're confident that the VA is going to be okay with that. And if not, we'll make it right.
All right. Chairman Fritz, you're recognized. Audit 4.
Mr. Chairman, if it's appropriate, my question is kind of a compilation of these four, if that's okay to ask that at this point in time. I would direct your all's attention to page 80, please, of the report. And the first is just a general question, and it's touch labor versus the admin general. When I look at the nursing services, I consider that touch labor in the process to care for the veteran. I'm sure you all would agree with that.
Correct.
And we see that we had an increase in both those from 23 to 24. It's the proportionality between the nursing services and the admin in general that concerns me a little bit. It's less than 3 to 1 in those two costs. Could you talk a little bit about what is specifically covered under administrative in general? Does it include the board salaries? And again, just a high level, what's under that $12 million?
Okay. First, our board members do not receive a salary.
Thank you.
Okay. Adam, Mr. Fleming, if I can defer to you.
So you're asking why from 23 to 24, the admin in general went from 10 million to 12 million? Is that the question?
No, sir, not really. I'm asking a little bit of an explanation between the 33 million and the 12 million, the proportionality there of what I would look at as perhaps the touch labor, which would also include the dietary. I see that's a $6 million figure just below that. And I'm sure that's part of the staff to help prepare the meals and so forth. But just help me better understand why that ratio is 33 to 12 nursing services versus admin in general.
Well, only thing that comes to mind offhand is I know that we added the facility in Cleveland, which is going to add to the admin. Give me just a moment.
While he's looking, Chairman Fritz, would you clarify, you're acknowledging there's a pretty big disparity between what we're paying for the admin and what we're actually doing to touch? Is that kind of where you're going, nursing?
Yes, sir, Mr. Chairman. Again, I understand that administrative and healthcare is a heavy burden. I do understand that. I'm just looking to help when the public sees our veterans and they see those figures and they see that we're expending $33 million in 2024, last year's numbers, for nursing care, and then we're expending $12 million just for admin in general, I think the public is going to want to know why there's not a bigger delta, Mr. Chairman. I would expect that number for what I would call touch labor to care for the veterans to be much higher. And if I'm missing something, again, the $6 million, I think when I read this, I understand that really connects closely with the 33 million because it's directly caring for the veterans. But help me understand, and for our constituents who may be watching, why is that ratio not broader? Let me just ask one. Are we heavy on administrative and general cost? And is it possible to be more efficient with less administrative and general cost and putting more of that money directly for the care of the veteran? Let me ask it that way.
Well, I can say that those categories on that particular report are very broad. Like the admin in general also includes like a bed tax that we pay for each of the beds. So all these expenses have been incredibly increasing over the last few fiscal years, of course. Trying to think of the other bigger items other than, of course, your labor. And again, we had to add several administrative positions for the new facilities coming in Cleveland and soon to be in Arlington. And additional heads within our office to take care of the additional expenses and the like. I'm not sure. I could look historically and get back to you. directly with a little more educated answer on this.
Thank you, Mr. Chairman. And let me, I should have led with this. I appreciate your all's work to help care for veterans in Tennessee. I know that's a tough question. I just think when I look at that, the public's going to ask questions about the proportionality of those figures. And I think it would be helpful if we could break that down better so that we would understand what is going to touch labor care for the veteran in the state of Tennessee, because it's not intuitive there. And it leaves the impression that we may be top heavy.
Understood. Thank you, sir.
Yeah, and if you would, I'm going to request what he did and just get back to us. You can get it to me and I'll get it to committee. Just kind of give us a breakdown on the administrative cost and help us to understand better. And we would ask you to do that in writing. You can address it to the chair of this committee, and then we'll share it with this committee and with our full committee so they've got it when we address this later in the year. And I want to echo again, we're not beating up on you. You got a tough job, and we appreciate what you're doing. But let's just make sure that our folks understand, we understand, and our constituents understand where we're spending our money. Any further questions that was finding 4, I believe. All right, let's go to finding 5, please, sir.
All right, finding 5, as noted in the prior 2 audits, management did not perform or document timely supplemental clinical assessments as required by board policy. We concur with this. The policies in question are not required by federal law. They do not go directly into the care planning process, and they do not engage with reimbursement in any way. They're our own internal policies or assessments. We've reviewed and revised the policy, and instead of the assessments being required, we're making them either under recommendation or as needed per se. And so the finding should go away or won't repeat because it'll no longer be internal violation of our policy.
All right, thank you. Any questions on finding 5? We will go to the next finding 6.
All right, finding 6, the Veterans Homes Management did not maintain sufficient controls to monitor mental health providers to ensure residents received the services that providers billed to the homes. We concurred here. There were some gaps in documentation or finding documentation and validating the mental health providers' specific visits. As stated by the auditor earlier, we use a system called AccuShield, which is a computerized system that checks people into the building and then out of the building. We found that provider was not regularly utilizing that. They're just walking past it. So therefore, the first tool we would have to verify that they were actually in the building on that day that we went and paid them for, that it did happen. What we did after the auditors brought to our attention those, we went back and looked at notes. Sometimes the providers are using hard copy notes, which don't get integrated into the EMR. The electronic medical record, and therefore it's not as easily to access those and finding those notes. 2 things we've done to correct this is we've drafted a memo to all the contract providers across the board, not just psych, that if they don't sign into AccuShield, their payment can be compromised. They have to prove that they were in the building so that they utilize this. We're hopefully putting a financial incentive or penalty to that. And then the other thing is our compliance officer is currently reviewing the mentioned physician billing logs for completion and accuracy. So we're not seeing any issues at this point. And as I said, we went back and looked to see if there were any visits that were improperly paid for where we did not find documentation. It was a tedious process, but we found that there were none.
All right, thank you. Questions from a committee? All right, seeing none questions. Well, before we do that, I have a couple, please. Tell me a little bit about, you may have shared this, your occupancy and what your waiting list looks like for folks trying to get in.
The waiting lists at each of the buildings, I can't give you the specific number, but it's well over 100 to 300 depending on the building. However, under the Tennessee Linton law, and the way the waiting lists are governed, most of those individuals on that list are not candidates at this time for nursing home care. So even though we have to contact each and one of them on a quarterly basis and see if they want to remain on the list or if they're ready to come in if we have a vacancy in one of the homes, they're not ready. Some of them we contact them and they're vacationing in Florida or they're 45 years old and they just got on the list. So 20 years from now, they might be number one or number two. Now, under the Linton law, that really doesn't work that way. Hospital discharges that have emergent need for long-term care come first and they bypass the wait list. And that's how most of our admissions come in.
All right, and your Arlington home, what is projected opening date for it?
Arlington, we're scheduled, and we'll see if they meet that schedule. There's some things that they have to reposition a boiler, which is a project for this month, for next month, for January. So once that kicks off, we'll be up and operational. Remember when they hand me the keys, we just got a big empty building. I got a staff, get a whole bunch of stuff ready. And I would anticipate if we get that building in January, we're going to see patient number one probably in March. By the time we get staff in and trained and go through all the systems and make sure they work. It's a very complex building.
Yeah, I have been through it when it was just studs but did have roof on it. If your committee would indulge me, I think I heard you say that you had to reposition a boiler.
Yes.
Can you explain that to this contractor? Why we have to do that?
Not my expertise area, but in essence, one boiler was positioned too close to another boiler. And when the boiler inspection came in, that failed and they wanted that repositioned. So the contractor is currently doing that if it has not been done yet.
That's called engineering slip up.
There's other words.
Chairman Jackson, you've got a question, I believe.
Yes, thank you, Mr. Chairman, and thank y'all for being here. It's a good report. I do want to ask, on page 25 of the report, there's an observation. And I asked this yesterday when you came to my office and we met, and you gave me a good explanation of this. But this has come out and that I've heard not a lot, but some about, and I wanted to, just for the record, to give an explanation of how this can happen. One of the state veterans' homes did not sufficiently document the updated list of residents' personal property. And you explained that to me yesterday, how that could happen and why it happened. Did happen in this case. And it's not a normal thing, but I just wanted you to, just for the record, to explain that.
Very good. One thing that does happen, and I didn't mention this yesterday, but this is a scenario that happens a lot. As I stated, most of our admissions come direct from the hospital. So the resident arrives with a hospital gown on. That's all they have. Then the family brings in clothing and things like that and personal items, whatever's needed. We don't know that that's always happening. It all of a sudden just appears in the room. Now we're not able to go in and inventory their room. It's their home. We can't just barge in and see how many t-shirts you have or whatever you've got, a clock radio or whatever. Electronics, however, they do have to tell us about. But the problem is, though, as even with families that admit and do bring things, you'll have multiple family members that will bring in items after the fact, which don't know that they need to be inventoried. So like I think I said yesterday, it's an exercise in futility because it's constantly changing over. And then families as well, inventorying their pajamas, let's say. The spouse may take those home to wash, as is their choice. But we don't know that they've left the building, so how do we adjust the inventory accordingly? Now, where we were remiss is the documentation was not there from the initial documentation. And what we're going to do to correct that is make sure even if they arrive from a hospital with nothing with them, that will be documented on that inventory, and that we can reiterate, although it is in our admission packet, that they're to inform us, families are to inform us when resident belongings come in.
Thank you, and that's pretty much like any nursing home.
Exactly.
The families come in, bring things in or take things out or whatever. You don't have a way to document that. So I just wanted that to be for the record. So thank you very much.
Thank you, Chairman Jackson. Any further questions from our committee? Any public comments? If not, we will entertain a motion, and I recognize Chairman Jackson to present that motion.
Thank you, Mr. Chairman. And what I have is a two-part recommendation. The first part is a motion for a 3-year extension for for this board of Veterans, Board of, Veterans Home Board. And then the second part is a motion that the State Veterans Home Board shall report back to the Education, Health, and Welfare, General Welfare Joint Evaluation Committee by December the 31st of 2026 to update the committee on its progress in addressing the findings and observations set forth in the December 2025 performance audit report issued by the Division of State Audit.
All right, thank you, Chairman Jackson. So that recommendation, that motion is for a 3-year extension with a 1-year callback. Any questions on the motion? We have a motion, we have a second. Senator Seal, you're recognized. Thank you for the second. No objection to the question. We will, the motions will call for question. Madam Clerk, please take a roll call vote in the Senate.
Senator Crowe, Senator Jackson. Senator Jackson votes aye. Senator Oliver. Senator Oliver votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Rose.
And I vote aye. This recommendation moves forward to the full committee with a 3-year extension and 1-year callback. We want to thank you for being here. Thank you for all that you do for our veterans, and wish you the best. And audit team, thank you. All the auditors have been here today. Let me just say this, just because we've got a lot of time, and I won't take the next hour and a half to do this. I brag on the state of Tennessee. I really do. When I speak to groups, I talk about being on this committee, on the Government Operations Committee, and that we have what we call accountability, which I don't see a lot of that in Washington, D.C., but I am proud of the state of Tennessee. Thank you for all that you do, and we really do appreciate it. Thank you all for being here today. And I have one other comment to make as soon as I can find my notes. And it says, this concludes committee business. The actions by this joint committee are submitted, to the Government Operations Committee for deliberation and final decision prior to being placed on the calendar during legislative session. Notice future meetings will be posted in advance, and I'm about to make a notice right now. We'll be meeting at 1 o'clock right here to do the audits and reports from the DHS and DCS, 1 o'clock right here. Thank you all for being here. Merry Christmas.